Hello everybody and welcome to the Thursday edition of Video Clips. You know, I've been cautioning for many years that there aren't any magical foods or nutrients that are responsible for health or lack of health. You can't play reductionism in diet. You know, let's take this out of the diet, put this in the diet, it fixes everything. But there is no question that if we wanted to talk about one problem ingredient, particularly as it pertains to kids, it would be sugar. I don't think anybody would defend how much sugar kids eat right now. And there's a lot of ongoing debate about how bad sugar is, what harm does it really do, but I think there is almost universal consensus that it's empty calories, and that one of the problems with sugar, in addition to weight gain, is it just displaces calories from healthier foods in the diet. Well, a new study sheds some light on specifically how sugar affects children's health. I found this study fascinating. Researchers enrolled 43 kids who were between the ages of 9 and 18 who are at risk of developing diabetes. All of the kids were obese, and they had at least one symptom of metabolic syndrome, which includes a whole spectrum of symptoms ranging from hypertension, high blood sugar levels, high cholesterol, excess body fat, particularly around the waist. The kids had historically been consuming about 27% of their daily calories from sugar. That's a lot, and it's unfortunately not atypical. The children and their parents met with dietitians who helped them to design a diet that replaced sugary foods with starchy foods. Now, the new diet did not lower their calorie intake. That's not what it was all about. It was not designed to help them to lose weight. Frankly, the substitutions were not that great. I was dumbfounded by this, but bagels and baked potato chips replaced sugar-sweetened yogurt and pastries. Chicken teriyaki, the teriyaki sauce contained sugar, that was replaced with turkey hot dogs and burgers. The goal, again, was not calorie reduction. It was to make sure that the only sugar the kids were getting actually came from fruit. The intervention period was only 9 days, but some amazing things happened in that very short period of time. LDL cholesterol dropped by an average of 10 points, triglycerides 33 points, blood sugar and insulin levels dropped, diastolic blood pressure dropped, and even though weight loss was not a goal and the calorie intake didn't change, there was an average of 2 pounds lost during that 9-day period. Now, the study showed definitively that reducing sugar has an almost immediate positive impact on markers for health, but long-term health improvement can't be inferred from this. I mean, the study period was short, the children remained obese and at risk, and there was no assurance that children and their parents would continue this level of sugar restriction, or that they would make additional moves to restructure the diet in meaningful ways. But I think the study results are pretty incredible, and we certainly will use them here to encourage parents to reduce sugar intake both for themselves and for their kids, and to replace those sugary foods with healthier starch-based options. I mean, if you can do it with bagels and potato chips, think how much the results would have been better if it had been sweet potatoes and black beans. So I think we can all agree kids eat too much sugar. Eating less of it and eating healthier foods is a better option. We'll keep talking about it. It doesn't happen without a lot of intervention and training and that sort of thing, but we're going to keep talking about it. Okay, the other topic I want to talk about today is computer-aided detection for mammography as an enhancement for mammography. It was approved by the FDA in 1998 for the purpose of diagnosing breast cancers that would have been missed through just plain mammography without the computer-aided diagnostic capability. In practice, this computer-aided detection appeared to be even better at turning healthy women into sick patients, because it detects tiny calcifications and other clinically insignificant abnormalities. So while CAD has been touted as finding cancer earlier when it's more treatable, this has never been proven. Instead, it really appears that it enhances the major failings of mammography. But that doesn't make any difference. Without any evidence to support its use, it's become a $400 million a year business in the United States, and the American healthcare system makes a lot of use of it. New definitive research shows that it's useless, and who knows what will happen. Probably not much in terms of changing practice, but basically here's what happened. Researchers looked at 625,000 mammograms that had been reviewed by to 271 radiologists for 323,973 women. Now, it's always hard to recite numbers here, but I hope you get the idea. This was a big study, looked at a lot of mammograms for a lot of women. They analyzed sensitivity, which is defined as whether or not the test correctly identified women who had breast cancer. Specificity, whether or not the test correctly identified women who didn't have breast cancer, and the detection rates per 1,000 women. And the researchers said the test was useless for all metrics included and measured. For sensitivity, the rate was, just to give you an idea, 85.3% with CAD, 87.3% without CAD. Specificity, 91.6% with CAD, 91.4%, 0.2% difference. No difference between the overall rate of detection and no difference in the detection of invasive cancers. It just isn't a better test. It doesn't help. The only measurement for which CAD was better was detecting more cases of ductal carcinoma in situ, or DCIS, which is almost always not cancer, but almost always women who are diagnosed with that are subjected to over-treatment, lumpectomy, radiation, sometimes chemotherapy, some opt for mastectomy, tamoxifen, aromatase inhibitors. Again, one of the big failings of mammography, one of the ways in which it hurts more women than it helps, is the diagnosis of not cancer, which then gets treated as cancer. So what the study really shows is that one of the worst things about mammography, one of the most dangerous aspects of it, is enhanced by the use of this computer-aided detection. The authors wrote, screening performance was not improved by CAD on any metric assessed. They also said the results of our comprehensive study lend no support for continued reimbursement for CAD as a method to increase mammography performance or improve patient outcomes. And they added, computer-aided detection does not improve diagnostic accuracy of mammography. These results suggest that insurers pay more for CAD with no established benefit for women. And therein lies one of the major problems in the healthcare system. While we're busy spending a whole lot of money on stuff that doesn't make any difference, we're not spending any money or very little money on the stuff that really would make a difference, like teaching people how to eat right and exercise and change their health outcomes and all that sort of thing. So anyway, it's frustrating, but you know, I do think that in every problem lies an opportunity, and it's our opportunity to change this. That's what I live for every day, is to change this whole mess. All right, so take-home points from today. Kids should eat starch instead of sugar, and do not have computer-aided detection, and actually go back and read the other 100 articles in the Health Race Library about mammography. You may not want to do that either. All right, that's all for today and for the week. As usual, have a great rest of the week and weekend. Pass this on to anybody who you think would enjoy watching it, and we'll be back to you next week with more news.